Bismillahirrahmanirrahim. Assalamu alaikum dear viewers. I am Dr. Muhammad Usman, Professor of Physiology, and in this short video we will talk about GFR and its determinants. So GFR means glomerular filtration rate. That is it is the rate at which glomerular filtrate is formed. Now what is glomerular filtrate? Basically it is the first step in the formation of urine. It is you can say it is the urine to be. Actually as you can see, this is the nephron, which is the structural and functional unit of kidney. So this is the first part of the nephron, that is Bowman's capsule. Then this is proximal convoluted tubule, this is loop of Henle, and this is the distal convoluted tubule. So this one is the glomerulus, okay, or these are called glomerular capillaries. When the blood is filtered from these capillaries, then a fluid is formed which is called glomerular filtrate, and it comes in the Bowman's capsule. Now let's see an enlarged view of the Bowman's capsule and glomerular filtrate. So as you can see, this is the afferent arteriole, this is the glomerular capillaries or glomerulus, and this is the efferent arteriole. So as I said, when the blood passes through these glomerular capillaries, it becomes glomerular filtrate. So let's examine the cross section of a typical glomerular capillary, and here is an enlarged view. So as you can see, the glomerular capillary, like the other body capillaries, it contains the typical two layers, that is this endothelium and then this basement membrane. But additionally it has an other layer which is epithelium. But this epithelium is not present continuously, but it is present in the form of these podocytes, okay, podocytes or foot processes, and the pores which are present in between the podocytes, these pores are called slit pores, okay. So this epithelium, it contains pores which are called slit pores. Plus this endothelium of the glomerular capillaries, it has also got some pores which are smaller in size, and these pores are called fenestrations, okay, these are the fenestrations. So together these three layers, that is endothelium of the glomerular capillaries, basement membrane and epithelium, together these form a barrier for the filtration of fluid, and this barrier is called filtration barrier. So we can say when the blood passes through this barrier, through these three layers, it becomes glomerular filtrate. Now let's see what is the formula for GFR. Now GFR is equal to Kf multiplied by net filtration pressure. Now Kf is filtration coefficient, okay. It is a measure of permeability and surface area of the glomerular capillaries. In the glomerular capillaries, the value of Kf is 12.5, okay. It is about double the value of Kf in the systemic capillaries. In the systemic capillaries, the value of Kf about 6.67. So it is because that the glomerular capillaries, they have much more pores and they are more permeable than the systemic capillaries. The net filtration pressure in the glomerular capillaries, it is about 10. So 12.5 multiplied by 10, it comes to be about 125 milliliter per minute. So it means that our glomerular filtration rate is 125 milliliter per minute or 180 liters per day. Now out of this 180 liter, about 178.5 liter, okay, 178.5 liter it is reabsorbed, and about 1.5 liter it is excreted as urine per day. Now another thing is filtration fraction. It is fraction of the renal plasma flow which is filtered. We can write down its formula as FF is equal to GFR divided by renal plasma flow. Now we know that the value of GFR is 125 and renal plasma flow is 650 milliliter per minute. So FF or filtration fraction, it comes to be about 0.20. Now it means that 20% of the renal plasma flow is filtered when it passes through the glomerular capillaries, okay. So GFR is 20% of the renal plasma flow. So what are the determinants of GFR? again we will have to refer to the formula of GFR, that is it is equal to Kf multiplied by net filtration pressure. So these are the two determinants of the GFR. Higher is the value of Kf, more will be the GFR. Similarly, it is also directly proportional to net filtration pressure. Now net filtration pressure is determined by starling forces. There are two forces in the glomerular capillary, and let's see how many are the forces in the Bowman's capsule. So as you can see here, this is the afferent arteriole, this is the glomerular capillary, and this is the efferent arteriole, and this thing is Bowman's capsule. So the two forces inside the glomerular capillary are glomerular capillary hydrostatic pressure and glomerular capillary colloid osmotic pressure. Glomerular capillary hydrostatic pressure, it is the major force or the chief force which determines GFR. Its value is 60 millimeter of mercury, and it favors filtration, or it favors the formation of glomerular filtrate. While the glomerular capillary colloid osmotic pressure, it is mainly due to the presence of protein in the plasma, and its value is about 32 millimeter of mercury. This force opposes the formation of glomerular filtrate. So this is the direction of the arrow, and it is showing that this force is opposing the formation of glomerular filtrate. Now ideally there should be two forces in the Bowman's capsule, that is one due to presence of fluid or filtrate in the Bowman's capsule, and this force is called Bowman's capsule hydrostatic pressure or Bowman's capsule pressure. Now its value is about 18 millimeter of mercury, because a considerable amount of fluid or filtrate is present in the Bowman's capsule, and this force, of course, this will oppose the formation of glomerular filtrate, because this force is due to the presence of fluid and it is a pushing force. So its direction will be like that, and it will oppose the formation of glomerular filtrate. Now the fourth force which you can think about, it should be the Bowman's capsule osmotic pressure. But why it is absent? Can you please tell me? Yes, it is absent because there are no proteins in the glomerular filtrate. So this fluid present here, that is a glomerular filtrate, it is devoid of any blood cells and proteins, and because there are no proteins here, so there is no osmotic force here. So now in a nutshell, so there are three forces. Okay, there are three forces which will determine the GFR. One is the this one is the favoring force, glomerular capillary hydrostatic pressure, and these two are the opposing forces. So we will subtract the opposing forces from the favoring force. So 32 plus 18, it comes to be about 50, and the total favoring force is 60 millimeter of mercury, and 60 minus 50, because 32 plus 18 it forms about 50 millimeter of mercury. So 60 minus 50, it comes to be about 10 millimeter of mercury. So the net filtration pressure is 10 millimeter of mercury. Okay, now let's see that how these forces they vary in different conditions. Bowman's capsule hydrostatic pressure, it becomes increased whenever there is obstruction of the urinary tract, for example by kidney stones. So in case of kidney stones, because of the back pressure, this Bowman's capsule hydrostatic pressure will be increased, and it will hinder the formation of glomerular filtrate. Similarly, if we talk about this glomerular capillary colloid osmotic pressure, now it can also decrease in certain conditions. For example, in case of liver cirrhosis and hypoproteinemia, because this pressure is dependent upon the plasma osmotic pressure. Now in case of hypoproteinemia, that is decreased protein concentration, plasma osmotic pressure will be less, and glomerular capillary colloid osmotic pressure will also be less. So the opposing force will be less, and there will be more formation of glomerular filtrate in case of hypoproteinemia. Now the third or the major determinant, it is the glomerular capillary hydrostatic pressure. Now glomerular capillary hydrostatic pressure, it is directly proportional to GFR, and its normal value is 60 millimeter of mercury. Now this pressure depends upon three things, that is arterial blood pressure. More is the arterial blood pressure, more will be the glomerular capillary hydrostatic pressure and more will be the GFR. Then the other two things on which this glomerular capillary hydrostatic pressure depends, these are afferent arteriolar resistance and efferent arteriolar resistance. Now let us see how these affect this pressure. Now here this is the afferent arteriole and this is the resistance of the afferent arteriole. Now when certain vasoconstrictor they act on this afferent arteriole, these vasoconstrictor like endothelin, they increase the resistance of the afferent arteriole as you can see here, and they decrease the renal blood flow. When renal blood flow is decreased, glomerular capillary hydrostatic pressure is decreased, and because this is the only force which is favoring the formation of GFR, so when this is decreased, GFR is also decreased. Now let us see what is the effect of efferent arteriolar resistance on the glomerular capillary hydrostatic pressure. Now angiotensin II, it is a vasoconstrictor which preferentially acts on the efferent arteriole because it has got more receptors here. So when it acts on the efferent arteriole, the resistance of the efferent arteriole is increased, and because of the back pressure, glomerular capillary hydrostatic pressure also increases and it causes increase in the GFR. But after some time, due to the increased resistance of the efferent arteriole, the afferent arteriole blood flow it is decreased because this the blood which is coming from the afferent arteriole, it gets resistance here. So afferent arteriole or renal blood flow, it is decreased, and when it is decreased, the glomerular capillary hydrostatic also decreases and it causes decrease in GFR. So in a nutshell, we can say that increasing the resistance of the efferent arteriole, this one, okay, increasing the resistance of efferent arteriole, it has dual effect. Initially it causes increase in glomerular capillary hydrostatic pressure, that is PG and GFR, but later it causes decrease in the renal blood flow and decrease in the PG and hence in the GFR. Thank you for watching this video. Please subscribe to this channel. Stay blessed and Allah Hafiz.